HCAM TV thanks you for watching this presentation. We'd love for you to become a member and use your creativity at our station. Please visit hinghammedia.org or call us at 781-836-5094 if you'd like to learn more.
Welcome back to our nation's transformation beyond the talking points. Woohoo! If you tuned into my last episode, you may remember that I was supposed to host a new show called Sesame Street 2.0, but it got canceled due to budget cuts. So here I am hosting this show instead, a show about spirituality and politics. Ha! Wow. Hey, you know, puppet gigs are scarce these days, and we gotta pay the rent somehow. Anyway, last week we focused on the idea that spirituality is not the same as religion per se. Spirituality is the idea that there is something larger than ourselves, and that we all come from that source. We're not human beings having a spiritual experience. We are spiritual beings having a human experience, as Pierre Teilhardin says. And as spiritual beings, we are connected to each other. So, living a spiritual life is simply making that connection between each other, the baseline for everything else. A spiritual life makes our interconnectedness the foundation for the thoughts we think, the words we say, and the actions we take. If we could truly allow spirituality to inform our politics, then love would be the bottom line, not profits and greed. If we allow love to be the new bottom line, then how would our laws and policies change to reflect that? They would do a 180. Wow, that hurt. Don't try that at home. Now, remember, love in this sense does not mean having an emotional attachment to someone. It doesn't mean we have to agree with each other. It doesn't mean we have to hug and kiss each other. It doesn't mean we even have to like each other. Love in the deepest sense means that we honor each other as members of the human race, no matter what. Period. We honor the connection we have with each other as energy beings living on Earth as humans. Period. That's it. And in this episode of our nation's transformation, we will focus on what our healthcare system could look like if we honored this connection between each other. What could our healthcare system be like if we actually prioritized people's well-being over the industry's profits? Well, our first guest on this episode will be discussing just that. He has been a registered nurse in the greater Boston area for over 20 years. He volunteered for the Bernie Sanders campaign in 2016 and has been a longtime supporter of single-payer healthcare. So, put your hands and paws together for tonight's guest, Mr. Tom O'Keefe.
Hi, Newton.
Hi, Tom. Nice to meet you.
Nice to meet you too, my friend.
Thank you so much for coming on my show.
It's my pleasure.
So, Tom, it sounds like that you have been a big supporter of Bernie Sanders during last year's primary. What drew you to his campaign?
Well, I've been aware of Bernie Sanders for many, many years, long before he ran for president. And there's many, many issues in his platform that drew myself and others that were drawn to work for that campaign. But one of the biggest issues is his long, strong support for a single-payer healthcare system in the United States.
Oh, single-payer healthcare. Yeah, I've heard that term a lot, but honestly, and I'm a little embarrassed to admit this on television, but I don't really know what that means. What exactly is single-payer health care?
Well, single payer refers to how we pay for our health care. So currently, we have insurance companies, for-profit insurance companies. We pay premiums for our insurance policies. We receive our care at our local hospitals, and then the hospitals have to go to the insurance company to try and get reimbursed for the care that they give us. There are numbers of different insurance companies with their all various different policies, and it's a very inefficient system. Now, what a single-payer system is that rather than having, we would be getting rid of the insurance companies. The insurance companies basically act as a middleman in healthcare. They don't provide healthcare. Single-payer is, we would have one entity that handles payment for insurance companies, and that would be a government program. And that would be paid for out of our payroll taxes. So you would have a new tax on your payroll deduction, and that would, that's where you would pay it, rather than having to pay monthly premiums, rather than having to pay co-pays for your not only your hospital stays but your medication. It's a much, much better system, and it's used in a number of countries.
Tom, hold on a second. Can we just back up there? You said a new tax. I can't possibly see anyone getting on board with a new tax. Another deduction from their paychecks? This is never going to work, Tom.
Well, this will work as soon as people realize how much cheaper it is for them, how much less that it is compared to what they pay for health care now. It absolutely will work.
So you mean it'll be cheaper in terms of the cost of health care premiums?
Not just premiums, but also the cost that we have for our medication, the cost that we pay in our co-pays every time you see the doctor, the cost to our employers.
Employers? Oh, do the employers pay a lot in insurance costs right now?
Employers pay far more in insurance costs than the actual individual does. Yes, they do.
How much, say take you, how much do you pay?
So at my previous employer, the last hospital that I used to work at, I think annually I paid about $2,500 out of my paycheck through the year for my health insurance. The policy that the portion that my hospital paid was $17,000 annually for my policy alone.
Wow, $17,000. That's a lot of money.
It's an amazing amount of money.
And that could be going to the worker's pocket instead of into the insurance company's pocket, huh?
It could be going into increasing the wages of the people that are working there. It could be going into actually increasing the number of employees at a given employer.
Oh,
there's a lot of things that could be used for.
So we could be employing more people too.
Yes, we could, absolutely.
Wow.
Potentially, yes.
So single-payer health care has the potential to affect a lot more than I thought.
Absolutely.
But hold on, back up just a second, Tom. When you said that under this single-payer system, that the government would be in charge of my own health care and not my doctor, well, I want my doctor to make decisions about my health care and my health, not some government bureaucrat. I mean, how could a government person possibly be a better person to make my health care decisions compared to my own doctor?
Well, your doctor would still make the decisions, although not to the extent, your doctor doesn't make decisions to the extent that you think.
No?
Actually, insurance CEOs really decide what your doctor can give you as far as treatment, what kind of care you can get, the quality of that care. That's actually decided not by your doctor. It's decided by the insurance companies themselves.
My doctor isn't deciding what kind of treatment I can get?
No.
Or if I can even get treatment at all?
That's correct. That's correct. The insurance companies write the rules for what the criteria that doctors have to abide by. So while people will say, I frequently hear, I don't want a government bureaucrat making my healthcare decisions. Well, I can understand that. We all want our doctors to make those decisions. But right now, you have a CEO making those decisions, and that CEO has an absolute benefit into denying your care. They make a greater profit for every claim that they deny. That's not the case with a potential government agency. A bureaucrat wouldn't be making potentially any money by denying payment for services that you've received at a given hospital. But a CEO of an insurance company absolutely does.
Oh, wow.
It's a major conflict of interest.
So insurance, you're saying that health insurance companies make decisions based on how much money they can make?
Absolutely.
Yes,
they do.
And it's not, their decisions aren't based solely on taking care of the patient?
I won't say that it's completely not based on taking care of the patient, but cost factor is a major factor in the for-profit industry. That's why it's a for-profit industry.
Huh. So the single payer system, the decisions would be more likely to be based on the welfare of the patient, the well-being of the patient.
Absolutely, sure. There would certainly be rules and criteria that to help doctors, guidelines to help doctors. Medicare, which is currently the largest insurer, that's a government program that insures people who are 65 and older, that has rules that all hospitals and doctors have to abide by. What's different is we're more likely to have a system where our care is based on solely what's beneficial for the patient than it is with a for-profit system.
Oh, okay. So are you saying that the single payer is essentially cutting out the middleman? That's the insurance companies.
That's exactly what it is.
Okay. And so then if you cut out the middleman, you are saving money on administration costs, and you're saving money on what now goes towards insurance company profits. Is that right?
That's right.
Oh, I'm starting to get it, Tom, I think.
That's not all. You're also saving money in drug costs. There are a number of other areas where this saves money. Right now, we pay the highest amount of money for the cost of our drugs in this country.
We, like you and me?
We, like you and me, pay.
Just you and me?
No, well, no. I mean all of us in the United States. We pay the
all of
highest.
us in the whole entire
all
country? Compared to who?
Compared to any major country out there.
Wow.
Yes, we do. Vast amount more than any other country.
We pay more for our drugs. Are they better? They must be better.
No, they're no better. They're no better.
Oh, you know what? This reminds me of a friend. She was telling me the other day that she needs inhalers, right? Mm-hmm. She used to be able to buy inhalers for, I forget how much she said. Was it like $20 or something? It was really cheap.
Yep.
And now she says one inhaler costs her like $300. That's crazy. How can that happen where it just goes up like that overnight?
Well, it happens because the drug companies rather, the pharmaceutical companies know that they can get away with it, simply because they can, because it's not illegal to do that.
It's not illegal to do that?
It's not illegal. No, it's perfectly legal for them to jack the price up to whatever it is that they want, and we are seeing that right now in real time. We're actually seeing cases of that actually in the news, which is rare.
Well, who would want our healthcare system to operate like that, Tom?
The drug companies, the medical device manufacturers, a number of the entities that make up the healthcare industry want the industry to be operated the way it is.
So it's legal for them to do this?
Yes, it is.
And they can't, I don't know who's in charge, they can't just, bargain for a lower price?
No, as a matter of fact, Medicare is, in law, cannot bargain for a lower price, which doesn't make sense. Anytime a company buys something from another company, when it buys in bulk, when it buys massive amounts, it can bargain down the cost of of a given item because it's buying so many of them. And
Okay,
would-
that makes sense. So
Right.
if you were a company and you needed to buy a lot of pens,
And you need to buy a lot
like
of pens. you
millions
could-
of pens.
That's right.
You could bargain with the pen supplier to get a lower price because you're buying so many pens.
Absolutely.
Okay, but you
Okay.
can't do it with this?
You
with
cannot
drugs?
do that with drugs because we've written into law that Medicare can't. Now, Medicare is the largest insurer. This is again the government program that insures people from age 65 and over, and they are forbidden from actually bargaining with drug companies to lower the cost of the price.
We wrote it into the law?
Indeed, we did.
Well, why would the lawmakers set it up that way?
Oh, Newton, that's an entirely separate episode.
Huh. Okay, Tom. We won't go there right now then. Maybe we'll talk about that in a future show. But you know what? Oh, Tom, speaking of a whole nother show, I better do a time check here. But because it seems like this could be a two-parter. I mean, there is a lot more to understanding healthcare than I thought.
Well, a lot of people are figuring that out right now, that healthcare is a very complex situation.
I'm not the only one that's realizing that healthcare
No.
is hard to understand.
No, there are a number of people that are just figuring it out just in the last few months.
Huh, interesting. Well, oh, you know what, Tom? I wanted to ask you about that whole employer thing that we were talking about before. Under our single-payer system that you're proposing, what would happen to my health care if I should want to, say, change my job?
That's a great-
Oh, wait, by the way, I just want to say, I'm Chris, my producer. Don't worry, I'm not going anywhere. This is just a hypothetical. Okay, what were you going to say, Tom?
That's actually a great question. Currently in our for-profit system, if you leave your job, you lose your health insurance. Or if you want to if you want to open your own business, you lose your health insurance. So with a single-payer system, the insurance is tied to you, not to your employer. So you don't lose your insurance just because you either lose your job or decide to change jobs or move halfway across the country.
Oh, so it follows you.
It follows you.
It's just part of you.
That's correct.
Oh, not part of your job.
That's correct.
Oh, well, that sounds kind of better than what we've got now. More freeing, allows people to more freedom in their life,
I agree.
where they're making more choices about their happiness and what they could do and what they could contribute to the economy instead of just, I got to stay here at this job that I hate because I got health care.
And that's a very common problem for people right now.
That doesn't seem right. Oh, and you know what else too? It seems like our healthcare system is so expensive that, is this right, that sometimes it causes people to go bankrupt, maybe even lose their homes?
Yes.
That happens?
Yep, absolutely, that happens.
Wow. And so under single payer, how would that change?
It wouldn't happen.
It wouldn't happen? It just
would not
wouldn't happen.
No, it wouldn't happen because you wouldn't have, right now, that happens because people require health care and either they don't have any health insurance and so they have to pay for it, they're billed for it, their care entirely, or they do have health insurance but it doesn't cover the entire cost of whatever treatments they required. And so in either case, the balance of what the insurer is willing to pay, or if they don't have insurance, all that falls on the individual. And actually, bankruptcy as a result of medical costs is the most frequent reason for bankruptcy.
It's not just because people, I don't know, wanted to gamble or go to Vegas or just were careless with their money?
No.
Huh.
The most common reason in the United States for bankruptcy is medical costs.
Wow. Oh my goodness. So Tom, are you saying that under a single-payer healthcare system, it would prevent people from going bankrupt, it would lower the cost of their drug prescriptions, it would allow them to change jobs or start their own company without worrying about their health care, and it would just generally save them money?
That's
All the
correct.
while they're getting better health care?
Yes.
Tom, that sounds like too good to be true. That sounds like a pie in the sky type of thing. I can't imagine that this system could actually become a reality. I mean, there can't be any other place in the world that this is happening. It sounds too good to be true.
Well, it's true in most of the Western nations. Single payer systems have been around for at least 70 years in many cases, since World War II for some countries. These are fun. We are the exception in the United States.
Wow, we're the only
for-profit.
ones in the major all the major countries.
That's correct.
Wow. So what could we do, Tom, to if people watching the show want to do something to help support single payer? What could we do?
Well, you could get in touch with your local legislator, both your local as well as your federal legislators, and let them know that you are a strong supporter of single-payer health care and that you vote.
Hey, Tom, I got a question for you. What's the difference between Obamacare, the Affordable Care Act, and single payer? Because all this time, I thought I was supposed to be rooting for Obamacare.
Okay, well, actually, two of those three things you mentioned are actually the same. So the ACA, the Affordable Care Act, is the name of the law that was put into place a few years ago. The nickname that the media gave that law is Obamacare.
Oh.
So the ACA and Obamacare are the same thing. And what that is we still have our for-profit insurance companies in place, but we now subsidize them. So to try and make private for-profit health insurance policies affordable, if you meet a certain income criteria, you can get subsidies from the federal government to help you pay for that. That's what Obamacare is. Now, single payer is getting rid of those insurance companies altogether, getting rid of that middleman.
Oh, so Obamacare still has the insurance companies in its system, and single payer does not.
That's correct.
That's the biggest difference?
That's exactly the difference.
So I should be rooting for single payer, huh?
You should be.
If we
Absolutely.
want a better healthcare system for everybody.
That's correct.
So who loses under single payer? The healthcare insurance companies.
The insurance companies would lose under single payer, absolutely. The people who work for health insurance companies would lose their jobs. They'd have to be retrained into other areas.
But there would be so many more people getting health insurance that it seems like there'd be
Absolutely.
tons of jobs for them.
We would suddenly require a lot more people in healthcare because now everyone would be covered.
Okay, so they're not really, maybe they're not going to lose their job. Hopefully they'll just get retrained into a different job?
That's correct. They'd have to get retrained into a different area.
Okay.
But it's not. We wouldn't be losing.
But no one would be getting fired over this, hopefully.
We would get far more new jobs than we would lose.
Oh, okay. That sounds like a win-win. So you know what, Tom? I want to come to the next single payer event. Do you know when that is?
Off the top of my head, I don't know when the next single payer event is.
Oh, well, what could I do to help, make single payer a reality in this country?
You can contact, and everyone else out there watching this can contact both your state and your federal legislators and let them know that you are a supporter of single payer, that you vote, and that you keep an eye on how your legislators vote.
Okay, so that means your senators?
Both your state senators, your state reps, your congressional senators and representatives, absolutely.
And how do I find their phone numbers?
Let me see now. There is a number, but I bet you know it, Newton. I can't think now.
Let me think. Oh, I know.
You know.
I did look up this before. It's in my notes. Mom, can you tell me? What? Say it? Oh, okay. Yes, she said, find your legislature. You Google those words, find your legislature.
Find your legislature.
And then
There
you just
go.
have to type in your address. And then it will tell you who your legislatures are and their phone numbers and email addresses.
Absolutely. There
But if you
go.
don't know your address, then you can't do that.
Well, if you don't know your address, you have bigger problems for that now.
Oh dear. That's true. Well, Tom, I just want to say thank you so much for coming on the show. I really appreciate you coming. It was a pleasure to meet you.
It was a pleasure to meet you, my friend.
And I hope you can come back sometime. You are a
Absolutely.
lovely guest.
I look forward to it.
Thanks so much. Have a good day, Tom. And may the force be with you. Bye. Bye. So, today on our nation's transformation, beyond the talking points, we had the pleasure of talking with Mr. Tom O'Keefe, who was a nurse for over 20 years and still is a nurse. And he's been a long-time supporter of single-payer health care, which now, after Tom has explained it so knowledgeably, I know a lot more about what single-payer health care actually is and how it could really help all of the citizens in the United States, not just some, all of them. So it turns out that single-payer health care would cut out the middleman, the for-profit insurance companies, and it would save people lots of money in the long run. So while people would be paying for the single-payer care through a new tax, they would no longer be denied health care or have health care costs that could potentially bankrupt them. They wouldn't be gouged for their prescription drugs. They wouldn't have expensive co-pays or premiums. And I still can't believe that we're the only major industrialized country in the world that doesn't offer a national healthcare system to its citizens. I mean, is healthcare a privilege or a human right? It seems like that's the basic question here. And if the bottom line is creating a system that truly serves the people and not the insurance companies, then single payer is the way to go. So if you would like to learn more about single payer, as well as some simple actions that you can take to help support this healthcare system, check out my website through me2you.com and click on videos at the top left. And from there, you will see links that will take you to this episode and more information about the single-payer healthcare system. Thanks so much for watching us. Tune in next month and watch us anytime on YouTube. Thank you, everyone. Bye.